everybody. Welcome to our weekly wellness talk, Wired from Within, where the mind meets the microbiome. So today we're going to be starting our series about the gut-brain axis, and we're going to be talking about and demystifying leaky gut.
Yeah, so if you guys didn't check out our intro last week, please make sure to go check it out. We basically introduced this weekly wellness chat and let you know that this week was going to be on leaky gut.
Yeah, so we just wanted to start off by explaining what leaky gut is, what's happening with the biology, what's happening with your body, and then kind of letting you know if this is something that you might be experiencing.
Yeah, so I'll start off kind of just talking about at a cellular level what's happening, what's causing leaky gut. And I'd like us to step away for a second from looking at it just from the gut, because what we see systemically is the same concept that's happening in the gut, but it's happening everywhere else. So I'm going to really start referring to it as epithelial permeability, which epithelium is just, it's the lining that our body creates around different organs and cell types. And so what's happening here is that there is different epithelial relationships, and that relationship is degrading for whatever reason that we'll get into. And by that degradation, it's allowing bigger molecules to go through. So I guess the first question would be like, why would you want permeability in the first place? Like, why were we designed to have any type of permeability? And it's really because we need water and ions to be able to exchange through our epithelial tissue. And we have a very beautiful system that's created to manage that. So you're going to hear the word zonulin as we talk about this permeability, because zonulin is the protein is one of the proteins whose main job is kind of managing this intestinal, the cellular relationship between them, and how permeable can they be? How much can we let through between these cell junctions? So zonulin is the protein that really manages that system. And what it's managing are proteins that are within the cell walls, one of which is zonula occludens. And what it's doing is it's kind of managing how they bind to each other. How are they building their scaffold? How high is the integrity of their relationship, or how loose is the integrity of their relationship?
I like to think of this system as fences, building a fence around your yard. Why would you want a fence versus a brick wall? Well, for me, it'd be because I want to still see.
Yeah.
But if the gaps between my fence posts are too wide, then anything can get in.
Exactly. So it's like, what are we doing, or what is happening at a cellular level that is allowing for this permeability to happen? And when this happens in the gut, it's leaky gut. And
you have the same thing happening in the brain. We'll call it leaky brain.
We can call it leaky brain.
because you have a blood-brain barrier, and when certain things happen, like high stress, traumatic brain injury, that sort of thing, this barrier is also compromised. And so what you see happening in the gut is also happening in the brain.
Right. So we're going to talk about different ways that zonulin will increase, which will increase the permeability of these cell types and the relationship between them. And it's kind of like a misappropriation of the system. It's kind of like an inflammation, where like inflammation's good when you have an injury and you need immune cells to get there, but then you end up getting all this bruising and edema and swelling. And so it kind of can go a little haywire, and the same thing is happening with intestinal epithelial permeability.
Yeah.
And so I guess we can talk about what's the downstream effects of that.
Yeah, absolutely. And with the brain as well, when something happens, increased inflammation is good, like you said. You need it. With any injury, the first thing that happens is typically inflammation to bring good things to the system.
Yeah.
When you have inflammation long term, that's when we see problems. And you can get neuroinflammation, and a lot of people have it, and you don't really realize. And it can be caused by a lot of things, because the first response typically of a tissue to injury is to be inflamed.
Right. And really, it's the body's way of being like, all right, let's get the immune cells to the site to surveillance what's going on and make sure that we don't have, a breach in the system.
And for repair.
And for repair, exactly. And really, the same thing is happening with the epithelium. There's a breach that's happening in the system, and the downstream effects of that is inflammation, which is causing a whole host of other issues.
Yeah, exactly.
So I guess I can talk about leaky gut, and then we can talk about leaky brain from that. But a lot of causes of this epithelial permeability in the gut or leaky gut is low fiber diets. So fiber gives our microbiota the ability to create short chain fatty acids, and those short chain fatty acids are the energy source for those cells. So if your cells don't have energy, then they're going to start to turn over or not really perform well. And then they can start to, kind of loosen that tight junction. Another thing that causes leaky gut is processed foods. We know that alcohol contributes to leaky gut. If you haven't checked out my blog on alcohol and the gut microbiome, I talk all about it there and how it's causing leaky gut. Really, there are foods that increase the amount of zonulin, and that is really something to pay attention to. You have something that you're consuming that is increasing the protein that is causing permeability in these cells to a degree that is not advantageous, and then allowing for other small molecules that shouldn't be able to breach, right? And gluten is one of them. That gluten increases zonulin. We know that emulsifiers that are in a lot of our dairy products increase zonulin. A lot of processed foods, I know I mentioned that, but they also increase zonulin. And it's important just to pay attention to making sure that what you're eating and how you're living your life, Christina's going to talk about stress here in a moment, that it's contributing to a good integrity of this epithelium.
So then, Mel, what if someone doesn't have sensitivity to gluten, sensitivity to dairy? What if they've gone and gotten those food sensitivity tests and it says they're fine? What if they don't experience any gastrointestinal issues with this consumption? Are you saying that it doesn't matter, that by nature these substances and what's in them contribute to leaky gut and gut dysbiosis? Or does it matter who's consuming them in the situation?
I think it always matters to a degree, right? I mean, we're different people and we have different biologies, but I know that my epithelial cell and your epithelial cell both have the same scaffolding proteins, and I know how they respond to zonulin, and I know that gluten increases that zonulin. So just from like a biological mechanistic perspective, it's happening. Is it happening to the degree that somebody who has celiac or somebody who has a gluten sensitivity is having a reaction? No. But the immune system is extremely complex. I mean, immunology is a whole beast of its own. So I might be recruiting these immune cells that are causing these mild issues, and somebody with celiac is recruiting these other more inflammatory and uncomfortable immune cells that are giving them more of a response. It doesn't mean that you can't eat gluten and I can. It just means you can tell more than I can based on who's responding to the breach in the system.
Yeah, and on that note, we typically find that people who have suffered from traumatic brain injuries, people who already have other autoimmune diseases, already have chronic pain, are more likely to notice issues from consumption of these foods.
Right.
And it's because of what you're talking about.
Yeah, absolutely.
And so I think that's, sometimes we will recommend these gluten-free diets, these dairy-free diets, and it's related to this process. And I think that's really important to consider. It's also, like you mentioned, related to systemic inflammation, which is huge with leaky gut.
Right.
It's a massive, massive component that we're trying to address. And so a lot of people who will come to us for, say, a concussion will be a little confused why we're trying to make dietary changes.
Yeah.
And it's really massive that we're addressing the implications that it's having systemically as well as within our gut and our brain, because all these components, they just feed into each other.
Yeah, it's like a horrible cyclic cycle.
Yes.
Can you say
Yes.
cyclic cycle? But really, like, to touch on what she said, because of this systemic inflammation, if we want to talk about another cause of leaky gut, inflammation on its own will cause leaky gut, right? So if you have dysbiosis in the gut microbiome, you have an imbalance of the microorganisms, then you might have more degradation of the mucus lining, which then exposes that epithelium to bacteria, and that causes inflammation, which then causes leaky gut. So it's not just, zonulin is one part of the relationship, but inflammation on its own can cause leaky gut. Stress on its own can cause leaky gut. And dysbiosis on its own can cause leaky gut. And everything that I mentioned before about processed foods and not enough fiber, all of these contribute to an imbalance of the gut microbiome. And the gut microbiome has evolved to be able to stabilize the system to avoid a breach in the system because of the immune system that lies beneath that barrier and how hyperreactive it can become and cause more systemic inflammation.
Yeah, and you just touched on the effects of stress on this system. I think that's a really important thing to talk about as well, the neurologic implications of stress and how it can directly relate to the gut and leaky gut.
Yeah.
When your stress goes up, you produce more cortisol. Cortisol is produced by your adrenal glands. They're like these little hats kind of that sit on top of your kidneys.
Yeah.
If you want to picture them that way, I certainly do. And when you have more cortisol, you have a breakdown in these tight junctions. So your epithelial cells aren't as close together. And like you said, that's really important because, yeah, we need stuff to come in and out, but we want it to be selective.
Yes, we want to be able to pick and choose.
Because it's selective against certain things. And I think that's a really important part, is what we're not allowing into our system. Because our body does a great job of dealing with these things.
Yeah.
And then it doesn't. And
Yeah.
yeah, and I think obviously that's the issue, right? Because we don't have gut dysbiosis until we do. We don't have brain problems until we do.
Correct.
And then that's when you start to see that cyclical nature of these relationships because of how they feed into each other.
Right.
A big topic I want to talk about in this cyclical nature is TBI, because that's a great example of someone who could go their whole lives with no problems whatsoever.
Yep.
They get a concussion, they have a stroke, something of that nature, and now it's everything we're talking about, all of these symptoms.
Right.
Diarrhea, constipation, memory issues, brain fog, headaches, migraines, chronic pain, you name it.
Yes, absolutely.
It's one instant, and all of a sudden, these patients come in complaining of these symptoms they've never had before.
Yeah.
And they struggle to understand how hitting my head in football can cause me to not tolerate the food I'm eating, to not sleep, to not be able to remember things, to have chronic diarrhea, constipation, incontinence.
IBD.
Yeah. And it's because of this relationship.
Right.
And what they've found in research is people who suffer from a TBI, 33% of those who suffer from a TBI will end up with dysautonomia, which is just an imbalance in your autonomic nervous system,
Right.
an imbalance in your rest and digest and fight or flight, which neither one is better than the other. You need them in
Both.
different amounts
Yeah.
for different circumstances. And when you disrupt that harmonious relationship,
Yeah.
it can be a dysautonomia,
Yeah.
which is a big umbrella term for things like POTS and orthostatic hypotension and all sorts of things.
Right.
But what they found with dysautonomia in general is that because it controls your autonomic nervous system, and we think of a part of it as being this rest and digest,
Yeah.
it controls your vagal tone.
Yeah.
And when you have a dysautonomia, it decreases that, which can cause decreased gut motility.
Mm-hmm.
It can directly increase the tight junctions.
Yep.
So they're not so tight anymore,
Right.
which is not fun. Decreases mucus production. And all of that can end up kind of directly causing things like you mentioned, SIBO,
Yeah.
autoimmunities, because it's affecting the zonulin production.
Yeah, and she just beautifully illustrated the gut-brain axis and how TBIs cause gut dysbiosis
Which
through
is-
that vagal tone being lost.
Which is obviously a very
Complex.
complicated topic. And we will definitely cover TBIs specifically on their effect with the gut-brain axis. But
Mhm.
just as a little preview,
Yeah.
I think it's important to talk about because it's something that everything can be great and then it's not.
Yeah.
And so I think that's really important.
Yeah, I mean, I also think part of that is like when you have this loss of permeability, what's happening in the blood-brain barrier is you're allowing there's a weakness now, right, in this blood-brain barrier, which is allowing 40 kilodalton, which is just a size, molecules to be able to cross into the blood-brain barrier or pass the blood-brain barrier. And part of that size includes inflammatory compounds, right? So now there's your neuroinflammation.
Exactly.
And it's just around and around
Yes.
we go.
Yes. So that was a lot of stuff. That
Yeah.
was a lot of information. But the biggest question is, what can you do? What
Yeah.
can we do to help?
Right.
And so I figured that would be, I'll let you talk about specifically your role here as our microbiologist.
Yeah.
Melody is absolutely fantastic. She is so thorough and just lovely to be around.
Yeah.
But why don't you kind of explain what your role is in this situation, especially here in our wonderfully unique clinic?
Yeah, so I'm flattered because Cristina is an incredible provider here as well. And a lot of why we find a lot of synchronicity within ourselves is because we're two sides of the same coin, really wanting to help people with this dysfunction. I'm looking at it from the gut side and she's looking at it from the brains side, but we can both see that the same dysfunction is happening and one is propagating the other. So
Yes.
together we can help them really in a more well-rounded way. I do, a lot of work on people's gut microbiomes, one-on-one sessions, and being able to determine what is the manifestation to you of this gut dysbiosis. And that varies for people, right? When we're talking about epithelial barriers, the first thing I think about is the skin. We're talking about psoriasis. We're talking about eczema. We're talking about acne. It's a very, very good first line indicator that there is epithelial disruption happening, right?
Yeah.
And things are angry. We talked about diarrhea. We talked about IBS. We talked about lack of gut motility. I mean, the amount of brain implication in gut motility. I mean, without the enteric nervous system, you can't have peristalsis, which is the contracting of your bowel. This is usually a symptom that people are struggling with. They're constipated, and it's not a pooping issue. It's a neurologic issue.
One of the first signs of a lot of degenerative or neurodegenerative conditions is constipation, like Parkinson's disease. That's one of the first signs.
Yeah, absolutely.
And it's because it's 100% connected.
Yeah, I mean, as somebody with neurodegenerative disease, it made me immediately look at my gut, because I realized that that was the biggest thing that had changed in my life at the time of my diagnosis, was my bowel habits. And so there's something to be said about disrupting that ecosystem and how that manifests systemically. You know, what was the question that you asked? We'll cut it out.
What do we do here? What do you do?
Okay, so what I can do to help is meet with you one-on-one and discuss these symptoms that you might be having, or you can be curious if there is dysbiosis happening. And we have top of the line testing here with BiomeFX. I just posted a blog post on it on our page. If you go to yourbbrs.com and click news, you can see Cristina and I's blogs there. And BiomeFX is whole genome sequencing of the gut microbiome. I mean, think about, you know, sequencing our human genomes, people doing ancestry and things like that's for our genomes. We're sequencing the trillions and trillions of microbes in your gut and then telling you what their relationships are, what their architecture is, is there dysbiosis, is there inflammation, are they performing their tasks appropriately, is there an environment where leaky gut is likely happening? And I am happy to be your, you know, on-site microbiologist to go through that bioinformatic information and explain to you what your ecosystem looks like here, so that I can facilitate the work that the doctors here are doing on, you know, recalibrating your brains.
Yeah. Brains. Yes. Brains.
Many brains.
I love that. There are so many times where I'll be seeing patients or doing an exam and someone tells me something and I run out in the hall and I'm like, Melody, can the gut do this? And she's like, actually, yes.
Yeah, let me show you how.
Yeah, and it's really amazing. And with my education, they do talk about these relationships and we do kind of learn and get a glimpse. But even with what I know, I am constantly surprised every day by the impact of gut health on what we do here. A little bit about what my side of that coin can do,
please,
is it's important to see and have a window into your brain health as well, because it is this reciprocal relationship. And we want to be able to treat it and address it from both sides. And so to start, what is your brain telling us? What is your specific dysfunction? What does it look like? How is it manifesting for you? And then what's the best way to treat it? Because every brain is different.
Yeah.
And so we use a lot of testing, a really awesome testing, so that we can get a picture into what your nervous system is telling us and what your nervous system needs.
And let me tell you, the amount of fluency that this woman has on being able to decipher what the brain can and cannot do is astounding and impressive. I mean, I obviously am somebody who has neurodegenerative disease. I suffered from a relapse of multiple sclerosis 10 years ago. Whoop, whoop. And haven't had one since. But, you know, Cristina was studying for her diplomate.
Yes. And like 2 weeks ago, I was practicing on this poor girl using my friend with a MS to practice for my neuro exam.
And I was very acutely met with some of my lingering deficits, you know, that I overlook every day because I've been rehabbing for so many years, and some of the more glaring deficits have resolved, thank God. But there is still I still have some deficits there, and she was able to really go in and extract them and show them to me so that I could more acutely attune to them and then pay attention to rehabbing that, because I was completely oblivious. I had become accustomed to those deficits in the last 10 years, but it's not okay to ignore them and not work on them. And so it's so important to have somebody like Cristina and the other doctors here at Brain and Body to be able to interpret what the brain is saying. And then please, you know, with pleasure, please come see me and allow me to be the voice of your gut microbiome so that you can then lead your life with more intention and more, you know, consciousness around what what you put in your mouth and how that's affecting this and everything. A lot of other neurological signs of, we talked about the skin, we talked about constipation, diarrhea, but brain fog. I mean, this brain fog is coming from the inflammation that is happening acutely in this breach of the system. And depression and anxiety and fatigue, these are all comorbidities of leaky gut, leaky brain, and asthma, right? When we were talking about, preparing for this podcast and all the different manifestations of epithelial permeability, I mean, the same thing is happening in your airway. The cells are not that different. Their job is to be a barrier, and sometimes we need to modulate that, and we are modulating it a little too much with the chemicals in the foods that we're consuming. And sometimes by creating TBIs, and sometimes by, just living our life.
Yeah, absolutely. I think I can speak for the both of us with our wonderful medical history that it can be confusing. It can be overwhelming, and it can be scary. What I love, and I'm sure what you love about Brain and Body, is we're able to look at you as your whole person, see everything you have going on, and we really are pretty much just a one-stop shop because of the amount of providers that we have here. We really are just a one-stop shop because of the diversity of care and providers we have here.
Yeah.
Because overall health and wellness is so important to us.
Right.
And being able to give you the care you need is so important to us. And so this place really is a family where healing and wellness and support is our number one goal.
Absolutely.
And that's why it's so wonderful and important to have a provider like Melody in a chiropractic and brain rehab facility because of the relationships that we're noticing and that the literature is showing.
Yeah.
And the results that we're already seeing are just
inspiring.
Amazing. Yeah.
Yeah. But
if you guys have any questions, we would love for you to drop them in the comments. You can email any of us from our website. Our information is linked in there, and we'll link our website on this blog or on this post. We'll link our blog posts in the comments.
Absolutely.
Define a couple maybe confusing terms.
Yeah. And please give us feedback. I mean, we're sitting here just mimicking the conversations that she and I have between patients.
Yeah. I mean, that's why we started doing this, is because we were just talking so much about this stuff, you and I.
Yeah. We were like, well, let's do it in front of
fun.
a mic. Maybe people will learn something. Maybe we'll learn something.
Yes, absolutely.
But next week we're going to be talking about
migraines and headaches, which is awesome because it's Migraine and Headache Awareness Month.
Hey.
And it's definitely, this thing keeps standing out. It's definitely something that's really personal to me.
Yes.
Are migraines and headaches. I've suffered from them pretty much since high school. My mom gets them. I have a couple different types of headaches, and the biggest impact for those have been functional neurology and addressing my gut. Yeah. And every time I do one and not the other one rears its head and tells me, look at me, pay attention to me.
Yeah.
And so we've been finding, not just for myself, but in general, that addressing both issues gets you the best results.
Yeah.
And so, next week we'll just talk a little bit about that and kind of provide a little more information. Just chat some more, hang out some more.
Yeah, we hope you guys come back and check it out. And it's been great.
It's been fun.